Hi, you are in the right spot if you want to learn about what to do during an eye exam if you have diabetes. Diabetes can have many effects on the body, but 3 of those are eye related. We can have diabetic retinopathy, which is bleeding in the back of the eye, early cataracts, and an increased risk of glaucoma. But I really want to focus on diabetic retinopathy and how we can use the eyes as a window to the body to, 1, figure out if your eyes are healthy, but 2, make sure the rest of your body is healthy and your diabetes is under great control. So what do we recommend? We recommend annual eye exams. In Ontario, OHIP covers you for annual eye exams, but unfortunately, OHIP does not cover advanced imaging and new technology. Actually, OHIP hasn't covered new technology in the last 30 to 40 years. So if we want current state-of-the-art care, unfortunately, there are some extra tests that should be done during your eye exam, namely ultra-wide field imaging and OCT, and now even more advanced OCTA, where the A stands for angiography. So let's talk about ultra-wide field imaging. This is taking a big wide field picture of the back of your eye that looks like this. And that allows us to look inside the eye and see the entire eye at once. It's absolutely amazing because if I'm using other tools to look inside your eye, I'm looking through a little rectangle of light or a different circle of light, depending on what instrument I'm using, and I'm trying to move that around to make sure that I see the entire back of the eye. But when I take the picture, it's all there. And what are we looking for? We're looking for hemorrhages or bleeding in the back of the eye. We're looking for abnormal blood vessel growth. We're looking for aneurysms. Cotton wool spots is where the blood flow is poor to a certain section of the eye, so you get swelling of the nerves, and hard exudates are fluid leaking into the retina that shouldn't be there. And then the next one is OCT and OCTA. OCT is where we take an image of the back of the eye, spin it, and look at the layers of the retina. So now we're looking at the cellular layers of the retina like layers of a cake, and we can tell if there are issues in the back of the eye. OCTA is able to take an image of the back of the eye and isolate all of the individual blood vessels in the back of the eye. And it looks like this, and this is new technology, and it is amazing. So when we do OCTA at the office, we're combining the top image OCT with the 2 bottom images, which is the angiography part. We can see fluid in the back of the eye. We can see microaneurysms and changes to the blood vessels. We can see vascular dropout where there's poor blood perfusion to the back of the eye that we can't see any other way. And this gives us some insight into the control of your diabetes, not just in your eye, but in your entire body. So again, annual eye exams, we recommend ultra-wide field imaging, we recommend OCTA. Unfortunately, there are some costs involved in this, so to be completely transparent, those costs are in the description of this video. We look forward to seeing the office. We look forward to taking care of you and making sure your diabetes is not affecting your eyes, but also making sure that it is well controlled so your entire body stays healthy.